Well, welcome. What an interesting time to be alive, and I think there's no better time than now to try to make America healthy again. I'm going to cover why we're doing this. I expect you doctors to have some good clinical skills after this that you can use in your office. Pay attention, we're going to have some fun stuff happen today. You want to stay up on how to get a hold of us. Dr. Jeff and Dr. Craig do some great things on Instagram. You're going to learn stuff about yourself. We share lots of things. It's very easy to get a hold of us. Anywhere, anytime, everybody, the world got smaller with all these virtual appointments. We have people all over the world, and it's been fun to have these interesting personalities, and we've had a blast. Anything, anywhere. There's very few restrictions around this world. It's very easy to get stuff. My shipping department is as good as anybody's out there. Now, a patient asked me today why I was doing this lecture, and we're going to do a lecture, a round table here in the future on burnout. I've played my burnout successfully enough that I'm ready to come back on a few lectures because sitting around at this point in history is not a lot of fun. So getting after some of these things has kept me engaged, and that's kind of why I did it. And also I have a couple things I want to share today. You know, this is why after 44 years, I have to watch it because this is the stuff that drives me nuts. This still bothers me from last year, one of the last patients I saw. I come in with this guy, I haven't seen him since 2013. He's the happy engineer. He's the perfect next door neighbor. He's the guy I would love to borrow a rake from. If I had to borrow a rake, it's going to be him. So this nice, gentle soul comes in, and he said, here, I'm here for a health check. I haven't seen you in 12 years. I'm ready to get back at it. This is his life. He takes Lipitor, he takes omeprazole, and he's had all the COVID series. What can I do to build on this? Now, I'm mumbling like Ralph Cramden in The Honeymooners. I can't take this. When I started in practice, healthy people didn't do these things. The things he's doing is going to wreck him. None of this is supported by the literature anywhere. We're the laughing stock of the world. And I looked at this kind soul. I said, how many kids you got? He said, 3. I said, I got a feeling one of those is going to get in this field. I said, which one of your kids? He put his head down. He said, a matter of fact, my son's taking the MCAT right now. I said, you wait till you see the stuff he tries to sell you in 3 or 4 years. Because I just watched the COVID thing settle down from people who thought they were doing the right thing. It's embarrassing what they've done to humanity. You are not going to live long this way. If this makes sense to you, this isn't the office. This is where we're at. This is now. We're 66th in life expectancy. We're embarrassing. Now, the sub-Saharan African nations that were lower than, do you understand what they're talking about? IQs of 70, IQs of 80. That's what they've let in the country. We're below them. This is what we've paid for. This is embarrassing. This is the year 2025. Can you imagine? People took medical advice from somebody that they had to pardon. Do you know where this is going to go? You really know where this is going to go? We've been programmed to accept all these new diseases. Kids weren't like this. It didn't look like a nursing home everywhere I walked today. It's embarrassing what we've accepted as normal. This isn't normal. We're in last place in the developing world, and we're crashing. When I go out in my personal life now, retirement, it looks like a nursing home without walls today everywhere you go. It's embarrassing, and the look on Kennedy's face says he gets a lot of this because he's an angry man because he knows what they did to Americans. My buddy, Judy Mikovits, follows my stuff. She's a brilliant researcher. Every vaccine is an awful big word, and I trust her more than any of these other guys on the payroll. Every is a gigantic word out there. You know, if after 44 years, if 4, 5, 6 years ago I did choose to retire, which I could have, I would have missed this rich era with the peptides, with the psychedelics, with all the nutraceuticals. We're going to have the richest time in health history that we've ever had, and I'm using this all on myself, and you'll see more as we go along. No one would believe it, but there's the guy that did my hip. Now we're going to talk about a very odd journey. I've not told this story before. That's Dr. Devitt. This is going to be a crazy story. I've waited to tell you a special story. Him and me, we had fun, and you ask him what kind of patient I was. He said just fine. We had no problems. I didn't take any of his prescriptions, but he didn't care. You'll find out about that. Now, you ready for one of the strangest stories you're ever going to hear about my life? So I go to have this guy. This is his right-hand woman. Her name's Alexis. This is the guy that chopped my leg off. So I go, everybody likes her. She's wonderful. She's delightful. She is his right-hand man. She's holding my leg. He's sawing. They got the bag over my head. Just kidding. And they're sawing, and she's got the leg at her head, and he's ripping my leg off. Just kidding. So they did a fantastic job. It's done. All right, let's keep going. These two people come in. He is the retired pilot for the Red Wings, Fred and Cindy. If you want to know if the Earth's flat, talk to him. He flies up there. He takes the athletes all the way up to about 45,000 feet. He claims you can see it. I've not been up there with him. Talk to him. He follows this office. He's a great patient. You know why he's a great patient? Because he went in for his Red Wing physical, and you men better pay attention. He's sitting for his pilot physical. The nurse walks in and gives him a shot and leaves. Walks back in. He did not have to have that shot. She thought he was the toilet cleaner. Does he look like the toilet cleaner? He said, I'm the pilot. Well, you didn't need that hepatitis B shot then. The rest of his life changed on a shot that he was given that he did not need. Now he's sick with these yeast issues that will be a lifetime because they put it inside his body. Thank you for sharing that story. He has had everything done by Dr. Devitt. His knees, his hips, I mean, they have Christmas cards together practically. So he tells Alexis, going back here, you need to watch this guy's lectures. You need to watch this guy's lectures. You need to watch this guy's lectures. So she watches a couple of my things. You ready? She calls her mom. Mom, you should see this guy's lectures. They're pretty cool. And her mom says to her, oh, him? You're only on this earth because of him. I couldn't have kids. I went to his office. He put me on some pills. Your brother came out. You came out. You're only on this earth because of him. She said, I just replaced his hip. Well, that's the guy that gave you life. If the Lord doesn't work in mysterious ways, say hi to Alexis. I told her to call me Uncle Randy from now on because we have a relationship. Everybody likes Alexis. Keep up the good work. Now you tell me if that's not a story for the ages. Unbelievable. Thank you for Fred and Cindy. They're wonderful patients. Pay attention. When they walk in with the magic needles, run. Now, you got a special story. I've waited. Now I want you doctors to pay attention. This is a big thing. Now, this is the hip I had replaced. Now, look at these two hips. Now, I'm not going to tell you, this is doctor stuff. When I measured these two hips with all my muscle testing stuff, the decay was the same. These hips are deteriorating equally. This is all genetics. It had nothing to do with hockey or work. This is my genetics. Now, this is very important. As you doctors pay attention. About 25 years ago, I'm a better skater than a hockey player. I got pulled down by better hockey players frequently because I was ahead of them. In my 40s, I got hauled down at Farmington Arena. It was the first time I had a serious injury. My legs were pulled out. I fell directly on the point of my hip, directly on the bone. Not to the side, not right on the bone. Geez, I never strung a joint. I'm not that meaty. Geez, that hip hurt. 6 to 8 weeks, I'm limping on that hip, and finally, it slowly went away. Now, you've heard me talk about my immune system. I know something has been dogging me for a long time. I showed that to Dr. Devitt. I said, look at those holes in my hip. Look at those are strange holes. He said, yeah, that's cystic. Well, that's the x-ray finding, but what caused it? The day before my lecture, the day before my hip replacement, July 1st, I'm sitting there, and I decided to really go into, my hip was getting warm. I checked for 6 Thymex, 0 and 6. It took 25 years to try to find an anaerobic staph infection. I said to my wife, my hip's infected. I've had an anaerobic staph infection with this weird little sore throat. Those holes in the bone were a bone infection. And anaerobic means air couldn't get to it, and that's why it just sits. You can't treat it. I could beat it down, and when they took that hip out, that funny sore throat left that I've had for 20 years. When I realized about 12 hours before my hip replacement, oh my gosh, my hip's infected. That's why this hip's hurt 10 times more than this hip, but they've tested the same. That crushing injury left me with an internal infection inside a bone that loves to flourish without oxygen. Having this cut out changed my health for the better. I was excited to have my hip replaced because it tests just like the other one. But there's what it looks like to have a sneaky infection sealed that your body can't get at because it's inside the bone. This changed my life to get that hip cut out. This is what I look like now. This is fantastic. This hip still doesn't bother me much. This was worth it. He did a great job. Now, I got to share something with you. There's a lot of things online right now that people are talking about. Ivermectin, fenbendazole, stage 3, stage 4. There's cancers everywhere. Now, for you veteran patients, not you rookies, you veteran patients have been with me, I'm personally, right now, doing some very advanced things on myself. Very advanced things. Why? Well, I'll tell you why. I've used a list of surgeons in my career, and one of my surgeons that I've used for 20 years just had an experience in the last couple weeks. It's all over. I suppose I can talk about this because it's popular now. Dr. Schmidt sent out a letter. He's been the guy that's done my hips and knees until I started using Dr. Devitt. So one of his patients gave Dr. Schmidt a hug and broke his ribs. He's full of multiple myeloma. He's out of practice. His staff is looking for a job. He sent out a letter to everybody. I texted him. I got it on my phone. He was caught off guard. Did he have a turbo cancer from the shot? Well, you can decide that whether he did, but he's out of practice. He's got a long journey ahead of himself. He closed his practice. Now look, I'm not going to get into this, but I'm doing some very advanced things on me. I am not waiting for those lumps. The Bible says 70, that's 70. When you start to get near the death zone, everybody's so worried about spending money on their health. I love to spend money on my health as long as it's for the right stuff. But I'm already heading stuff off at the pass because I know things inside my body are starting to misfire. And I'm working on some advanced things because I feel horrible. Dr. Schmidt was sawing off legs one day, and I can't believe he did not see this coming until his ribs were crushed. Unbelievable. So I'm working on stuff so I can be around here. There. I need you to read this disclaimer because I am not your doctor. Looks like some of you. Read this. Consult your doctor with everything because our system's crooked and criminal, and everybody has to say that because you're supposed to go to the guys that give you a shot and kill you, and if you do that, that's legal. But you go to anybody else, you better not get healthy because you'll be in trouble. Don't you dare get healthy. Now, there's what they gave me. How many of those do you think I took? None of them. I did those. I'd not taken an aspirin. They gave me doxycycline. I took Congoplex. They gave me meloxicam. I did ACP. I cleaned out my arteries for a couple of months beforehand. I don't want to clot from this thing. I made my blood slippery. I want to poop. The OxyContin is awful tight. I took out the swelling. I had hardly any bruising. I don't want any of that stuff except the OxyContin. Now look, I could have loved to talk to Dr. Devitt, but this guy's so busy. For 2 weeks before this surgery, I can't take any Advil, ibuprofen, or blood thinners. I can't take anything that makes me bleed. So as soon as I get done and they've wrecked everything, now you can get on those things that make you bleed. It's the most ridiculous suggestion. These things make your blood slippery and repair the capillary bed. I got an idea. Let's use stuff that makes it slippery and microscopically repair stuff. That's how you heal stuff. You don't put them on stuff that makes them bleed after they've been cut. It's ridiculous. He said, you take the pills? I said, no. I took the pain pill for 3 days because they do that good of a job, and maybe 3 nights because I couldn't sleep. I wanted to poop, so I took the Colex and that Colace, and I kept my bowels very regular. I don't want to get into that mess. But when I talk about doing things, this is what I did. I'm not telling you to do this. When I talk about this, I do it. I don't just peddle this stuff. I actually do it and live it. The girls came to visit me. There's in my infirmity. It was that hip. There's my palatial place that I live. I'm not doing that. I don't want to hear me. All right. This is my mother-in-law sent me this picture. This is what this lecture is about. We're going to talk about some things because I have some real problems at this point in my life with men. Now this is me. My wife had just I'm 18. She had just graduated. She was in 76. So this is graduation day. Now the kids, we were all like this. We're going to tell some stories about the olden days today. You guys will enjoy this, but this is in front of my mother-in-law's house. And my point is, it was a different generation. We were different guys. Us guys this age struggle with this generation behind us because we're nothing like them. We have some stories today. This kid had a little bit of swagger in him. Me and my mother-in-law did not get along whatsoever. Now, do you think I walked up to the door, or do you think I beeped the horn? I'll let you decide. That picture's here. This is where we were. About 1975, there's peak. This is where we're at today. These guys and those guys don't get along very well. But it's fun to have these guys as my competition. This lecture's for the men and some of the women. You've lost your mojo. You lost your promotion, you lost your wife, you lost your job, you lost your girl, you lost everything because you don't got no game. They weakened you and it worked. This is what they've done to the men. They've done it to all of us. I've fought this off. I've loved my competition. To erase fear by keeping my hormones up like a guy helped me be successful. You men are afraid of your shadow. It's embarrassing what they've talked you into. I did this lecture because of fear. I've watched you guys. I can make you cry easily. I can talk into shots. You should see the guys they play with at hockey in Redford Arena. They work for Ford. They get out of the car, put their masks on. If you ever been in Redford Arena, it makes a urinal smell good. It's the most disgusting, it's filthy. They get out of the car, put their masks on, and go in to put their skates on in a toilet. They got their colonoscopies on schedule, they got their shots on. I just sit and watch these guys one after the other. Have you had your colonoscopy yet? I'm still a virgin. I'm good. I said, untouched for the very first time. To watch, I have to live with this stuff. I'm embarrassed what they've done to them. It's fear. You're going to know about fear. The men, you can have your biker coat on, you can have all your tattoos. You're afraid. The bigger you are, the more estrogen you're producing, and I know that. And I've watched fear run these men's lives. Everything, their blood pressure. I had one today, for Pete's sake. They'll have a heart attack because their blood pressure goes up a point because they made them weak. It's embarrassing. I'm a weenie. I'm the youngest in the entire tent pile. I have never considered myself to be a tough guy. I've never been punched in the face. I've never hit anybody in the face. You don't have to if you have this thing working. I don't want to get punched in the face. I don't even want to wreck my hand on somebody's face. Fear. Now pay attention. We're going to try to toughen you guys up a bit so you can move on in your life. They come in to get a job. This is what I lost my job. Well, look at you. I'm not going to hire you. Exercise, stand up straight, get your hormones going, do some shakes. It's time to engage yourself. Push the chemicals out of your body because you're weak. I'm not going to hire you. I can spot them a mile away. I'm too good at this. This is why I did this lecture. This. Low T men and women parse information through a consensus filter as a safety mechanism. They literally do not ask, is this true? All they want to know about, will others be okay with me thinking this is true? Is everybody happy? I don't want to get anybody upset. They have to filter everything through the majority. High T alpha males judge right and wrong. It doesn't matter what the consensus think. You're not going in the ladies' bathroom with a kid. That's wrong. Men can't do that. I sat in a Walmart line about 2 days after COVID right here at Grand River Novi. There's one cashier open, like 50 people in line. And I'm going to tell you, that Walmart right there in Novi, whitey is the minority. So the whole thing, I have all the Asians, all the blacks, all the Indians, every single one is masked up. And there I stand in the middle of that line. And you know what it's like to have 100 sets of eyes just giving me. The foreigners follow instruction because they're scared. They don't want to get in trouble. I had 100 sets of eyes just glaring at me. The big guy behind me, they're all shaking because they know they're going to die from COVID. I had to stand there by myself getting the, you know what I did? I stood there by myself and gave them the same eye they gave me. How many men are left? The country's almost gone because we lost the men. It's embarrassing. You want a girl like that? She's not going to take a weenie. If you got to make sure that everybody's happy, you are not a high testosterone man. Right or wrong is what it is. When Halloween's over, the party's over. They still got the costumes on. When you got to say no, say no. But that's how simple it is. Is everybody okay? We didn't hurt anybody's feelings, is it? It's right or wrong. It's simple. It doesn't have to be murky. The men lost this, and they all lost this. There's my wife. Do not let these girls fool you today. These girls are tougher than you men. You've been interneted out thinking they're like what you see. I have tough women, right? There's 3 tough ones here. They're nothing like you think, this boyfriend-girl thing, this illusion that you've had. These women are tough. Cindy, Sandy, and Sue. They all run businesses. Cindy Sharp, Body Renew, Sandy Buttry down in Murfreesboro, Tennessee. They're not going to put up with weenies. I have to be strong to deal with them. They're tougher than me. And what kind of stones are you guys carrying today? Don't let you think, oh, they're really nice and pretty. They're not easy and soft. They're tough. Most of the women are. This is who I married. I married the firstborn daughter. She's tough. And remember, if you don't want fear, the more beer you drink, the more fear you're going to have. Do not drink American beers because they feminize the men. If you got to drink beer, drink German beer because the estrogen count is significantly lower. You should never drink American beer because all it does is make you scared. Now, I wrote a little list here. I want to see how many of you guys can pass this. Now, I don't know if I can get all these, but I never considered my a tough guy, but I wanted to make a couple suggestions. You know, if you spend more on a haircut than your wife, there's a good chance you got low testosterone. If you smell better than your wife, I know for a fact you got low testosterone. If you got more shoes than your wife, we don't have to go any further. If germs, bugs, and foreign people scare you, I watch the men scrub themselves to head to toe because they touch something. You got low testosterone. If you got a shot because somebody else told you to take it. Your nurse, your daughter-in-law, your sister-in-law. If somebody talked you into a shot and you knew it was wrong and now you're sick, I got all kinds of people sick because somebody else said that had very little IQ, they were brainwashed by Moderna and Pfizer, you got low testosterone. And I'm ashamed at the health crisis you'll have from somebody that did not do their homework. If you look more in the mirror than your wife, I got women complaining about that. You ready? Now I'm going to get in trouble for this one. This one's trouble. I have gorgeous single girls that work for me. They show me your dating stuff. We have a blast with this. Any dating picture of you holding an animal, you need more testosterone. Girls aren't looking for rainbows and flags. They're looking for a man. Ask them. They're sitting here in front of me. If you have to, we flew back. I was on a plane. Guy had to borrow a pen next to me. He was a double masker. And after he touched my pen, signed his piece of paper, he gave himself a shower in the seat next to me. Now, it bothers me how weak these men were. I did the best I could. If you have no job and everywhere you go, you leave a bad review. There's people out there, all they do is complain about everybody's everything, and they've never done anything. So if you're one of those people out there that trashes all these people's businesses, and you've never accomplished nothing in your life, and there's a lot of you out there, you got low testosterone. If your nails are cleaner than your wife, done. If you mask in the car alone, open and shut. If you got a makeup drawer, as a man, you don't need to do that. You can make yourself look healthy. This is not, we'll talk about this. You can make yourself look healthy. Men, I want you to take a good look at the bumper stickers on your car. Take a good look. There might be a good reason why you're alone still. You know how many doctors have come to me and said, boy, I sure wish I had the guts to practice like you. You know how many doctors said that in my 44-year career? Really? You're afraid to get sick people better? Yes, they're afraid. If you put a mask on your own business, licensing and regulation was taking pictures of me through the window. They keep in to hassle me. I had to go head to head with them. Did I cave? No. Are they wearing visors? No. I said, we're not doing this. It's time. This is a private business. It's time to leave. My testosterone was higher than his. Is yours. How did you handle this? If you, as a medical professional who took the Hippocratic Oath and then took dollars to whack and stack people knowing that this was bad, not only do you have low testosterone, salvation's probably out of reach for you. If you got 6,000 people vaccinated, 6,000, they gave you $1.5 million. If you could talk 6,000 people into getting this shot, that's a lot of people. $1.5 million. As a doctor, people are still asking these people for advice. I can't believe it. I walked away when I was a kid. Look at your hands, man. If you wash the hide off your hands, it's bad. You have low testosterone. If you've ever been to the emergency room for a cough or a fever, we can't have fevers or coughs anymore. It's 15, 20,000 at the emergency room to watch your kid cough. Let's work on that. I'm talking to the people in Detroit. Oh, I got a bunch of this is for you. If you vote a certain way because someone else told you how to vote, I'm positive you have no testosterone. Now look, I went to lunch with Randall Tent, the heli realtor today. I asked him point blank, have you ever seen me out of control? He said, nope. If you've been a drunken fool, rolling around on the floor in front of your kids and making a fool of yourself, you have low testosterone. I am not a saint by any stretch of the imagination, but my kid said to me, I have never seen you out of control, and I respect you for that. I've seen the other dads out of control. I've never seen you out of control. They missed some of them, please, I'll tell you. If your first car willingly was a Subaru.
Okay.
We'll stop there. I was just kidding. This is my son. I watch you guys begging for dates online, just begging. Please, somebody take me. Anybody take me. This is my son and his wife. Now academically, she is by far the smartest one in the family. There's nobody that's going to beat her taking SAT. She was going to be a medical doctor. She wanted to be an emergency room doctor. Thank God Sterling got in the way. So my grandson stopped all this because Dylan is not in. My son's never been to a pediatrician. Shots, no pills, no chemicals, nothing. He loves to talk about that. He said, instead of, hey, I'll do anything you want. I'll carry your stuff. He said, look, I've never had a shot. If you become a doctor, you ain't getting a shot. If we have a kid, he ain't getting a shot. That's a deal breaker because I'm not dealing with one of these kids that are wrecked. We've been around this our whole life. That's how he started. Now, her brother got married in Sweden. They work at Google. It's a smart family. They made him sit outside at the wedding in Sweden because he wouldn't get a shot and wouldn't wear a mask. He's never forgotten this. You're going to eat this one day, guys, so just remember, he doesn't forget. So what did he do? He rented a motorcycle and went through the Alps on a motorcycle rather than sit at a wedding. You tell me who lost. I'm proud of my son for being tough. He did not cave at all. Would you have stood up to her, or would you have done anything she wanted just to have a pretty girl like this? He didn't care. He's a man. If you want a man selling your house, he's killing it out there. Look him up. He's got a helicopter. He's doing it from the air. Now, here's your stories. All right. There's the boys. This is my homeboys. Ron, Norris, Robbie, Jimmy. Sue has been around that long, so it was the guys and, her, because she was around then. So it was this world, I usually had her around with these things. So we got together at Corsi's restaurant, the famous Corsi's restaurant on 7 Mile. Okay? Now, you ready? If you guys, the first question about this was what, November, end of November, beginning of December? We walked out of there that day, all of us. He's on oxygen for congestive heart failure. I haven't seen Norris in 30 years. We all got together. And remember that wet cough that was going around last fall? It was that wet, everybody got it. We walked out of there, everybody coughed for 3 weeks. Had that wet, everybody came in, the patients came in with it, everybody panicked. It was a wet chest cold. They had that mystery fog going all over the place. My sickest friend is here. I take all the stuff. Everybody got the exact same cough. These guys didn't go to work. I worked the whole next week because it really didn't bother me. I walked outside the door, coughed all this junk up. The patient, are you sick? No, I was. I'm coughing. I'm fine. I told the patients that came in, I said, look, if you're reasonably healthy, you don't have to take nothing. This is going to take 3 weeks to get better. If you take the pills, you're going to cough for 3 weeks. If you don't take the pills, you're going to cough for 3 weeks. If you're sickly, I want you to treat it with some Allerplex or something simple. But if you're not sickly, it just was an irritating chest cold. It took 3 to 4 weeks to finish it up, and I never stopped the cough. I want my body to stop it when it's done. Everybody got it. This is my athlete friend that we have some strong memories with. And you get a special story today. We're going to talk about fear. We weren't afraid. Now, you ready? You're going to like this. This is Norris. So I said, Norris, you got that story you want to tell your wife, and she wasn't there. I said, get out of here. No. I said, Norris, is the T-Bird story set? He said, yep, it was a blue one. Now, you ready? All the girls, I lived at 6 in Inkster. We had all the guys. All the girls, now my class reunion's coming up in August. 50-year class reunion, Stevenson class of 75. So I know some people will see this. I'm looking forward to seeing people at the class reunion, but this involves this. 7 in Merriman were where all the girls were. We figured that out pretty quickly. Now, 6 in Inkster, for all you people that know Livonia, that was a gigantic subdivision. And all the girls were at 7 in Merriman. It's pretty easy. We figured that out young. So hitchhiking, getting there, whatever. Now this is your story. This is special. I'm asking you about fear. What are you going to do? Who's thinking for you? I got the parents thinking for the kids all day. We had to think for ourselves. It's 2:30 in the morning, maybe 3. Now back in 72, 73, at that time there's nothing. It was dead. There's nobody on the road. We're leaving the subdivision of girls. We know where that's 7 in Merriman. So me and Norris head to 7. We're at 7 in Merriman. Now we're walking down 7 Mile. We're walking. We're going to go to Purlingbrook. Now Purlingbrook's about a half a mile. It's not far. So Norris is behind me. There's nobody on the road. We're walking down 7 Mile in the middle of the night, and Norris is behind me. I have no clue he's doing this. A car pulls over. Now, at that time of the day, at night, there's nobody out driving around. It's normal. So this car pulls over. I said, Norris, we're only going half a mile. He said, I don't want to walk. He was half in the bag. So we pull over. All right. It was a blue T-Bird. So the first guy gets to the car, opens the door, opens the back seat. So I climb into the back seat. I'm in the back seat. Norris is in the front seat. It's 2:30, 3 in the morning. Nobody's on. We're on 7 Mile going towards Detroit, going towards Middle Belt. Now, he goes flying by Purlingbrook. We're getting off there. He turned around and looked at me. Don't you want to go in the woods? I will never forget this. I burst out. Now, what are you going to do? He looked right at me and said, don't you want to go? I burst out laughing. I started laughing. Yeah, right. I'm looking for an ice scraper to give him an enema with. There's no way I'm going in these woods. Now, we're moving towards Middle Belt. We're past our street. We're coming up. It's 2:30 in the morning. I start rolling. He's catching that red light. I start rolling that back window down. Thank God it was not the electric. I'm rolling that window down, and I'm sliding through that window. And I got out of the car. I'm running alongside the car. Norris does not know what's going on. I said, Norris, for Pete's sakes, hey, what are you doing? I opened the door. I reached, pulled the door open, and I dragged him. This isn't where we're going. I said, Norris, get out of the car. He's trying to take you in the woods. Now, this is me at 16. Now, this was before that time. I was probably take a year off me then in the back seat. So, having many adventures, that's one of like 1,000. We had to get out of our own situations, and we had the stones to do it. That's why we're here today. What a crazy story. I'll never forget that. And I'm still here to talk about it, thank God. Now look, everybody heard something weird happened about a week and a half ago now. I missed a day and a half from work. I was deathly sick. Deathly sick. Walked in Wednesday morning, and I was bent forward. I want you people to hear this because you have one chance at this and one chance only. You don't have two. Bruce was sitting out there. He saw me walk in. He said, what's the matter with you? I said, I got a knot in my stomach. My stomach's killing me. Now it's here. Now I can't stand up straight all morning. My stomach's got a knot in it. And I'm getting a little sweaty. I got a right lower quadrant knot. Now I'm getting nervous. I'm getting sick. I'm getting sick. This is not the kind of food poisoning I'm used to. Everybody's had food poisoning. You get the runs, you throw up. A couple times, you're fine. That's the easy one. I'm getting the bad one. Now pay attention because you need to know how to play this because you don't need to miss this. I got this. I can't stand up straight and it's getting worse. So about noon, I told the girls, I'm not going to make it. I'm just not going to make this. I got to go. So for me to do that, I get in the car. I'm driving home, trying to get home before something crummy happens. So I get home. I got this huge knot, and I can't stand up straight. It's killing me. So I'm not sure all the things that are going on. You're going to see, looking back, I played it perfectly, thank God. So I got this huge knot in my stomach. I go home, I threw up 9 times, violently. I call the girls, well, I'm standing up straight. I think that was it. 2 hours later, it's back. I'm forward. My gut's in a complete knot. I'm pacing the floor. Now this knot is so hard, I can't believe how. I gotta figure out what's going on here. I threw up 9 times. I did 3 hours pacing the floor. Now I've thrown up everything in my gut, and this thing's killing me. I'm drinking silver. I'm going to tell you how I fix this. I'm doing this drinkable silver. I'm drinking this and coconut. I got to give myself something to throw up. The knot would come back. I'd lay in the shower. I let the shower pound on that. About 15 minutes, I'd stand up and I'd throw up 3 times. Then it could stand up straight. I got out of the shower. I'm walking around. About an hour later, it's full. I can't drink the silver, the coconut. I had to give myself a medium to carry it with. I probably threw up 22, 23 times, and by 4:30 in the morning, done. This is how things start. So many of these things are food related. There's crap in our food. I had a frozen dinner. This is not the typical, this stuff does not just come out of the blue. This is killing us. Our food supply is toxic. Now stay tuned. Now, this is on the cruise ship. None of this involves a probiotic to fix this. This is not that kind of food poisoning. I'm teaching you all how to do this. You don't want to get stuck here. There's the one on the cruise ship. They all had diarrhea. Citracil is going to work on that. There's salmonella. That's pretty easy. I got this one. I had a frozen TV dinner that got too warm and frozen again. I'm going to teach you about this. My friend Eric got that from lobster. He lost 20 pounds and was sick for a year. E. coli cost Mark his colon. He had an E. coli soaked salad and he was crapping blood in a couple days. The faster you poop blood, that one's going to get you. Listeria is from the lunch meat. Staph is less. What do you think appendicitis is? It's this crap in your appendix. It's food poisoning. Your appendix doesn't just blow up for nothing. This thing's working towards my appendix, and I got to get rid of this. My gut went in lockdown to make sure everything went this way. Everything. Nothing was allowed to get down because this was what was waiting for me. I thank God I played this correctly to get my gut back to normal. I'm drinking that. No probiotics involved. If you go on a cruise ship, 1 in the morning, 1 at night. Any hot destination, that's what your missionaries, 2 in the morning, 2 at night. I chugged that till that allowed me to throw this thing up in my gut. Last week I had a lady that crapped her pants a number of times. Giardia, cryptosporidium. That waterborne one, when you're pooping your pants, pull out the ADP and break it in half. You're behind the 8 ball, coat your gut with the citracil tabs if you're pooping blood. Those things will kill what's on that list. Have those on hand. You're not going to get an appointment anywhere when you need this. I started chugging that stuff because I knew I got to get rid of this. This would have wrecked me. If I went to the hospital, they had to relax that cramp, I'd have been a muscle relaxer, an antibiotic, everything would have been played stupidly. My body, I spend good money on my health. When it's sick, I have to trust it. It knows what it's doing. It's not stupid. People treat their body like it's a tinker toy. It's brilliantly designed. I knew I could throw this up given the right set of circumstances. My wife had stuff ready to go to the hospital. That's how sick I was. But that's how I got rid of it. And be prepared. Have this on hand because you have no time. Order it. There's the shake I did to get I started to want to eat again. All right. There's my peptides, my nitro greens. There's this what I found. All right, I don't want to eat anything. That's settled perfectly. I can't do it any better than that. Now, the peptides, I'm going to let you read this on your own. Read about the peptides. It's very important stuff for building up your body. You can stop this on your own. Now, after my gut was locked up, you're seeing all over the internet, magnesium glycinate is for sleep, I wanted my bowels to relax. I wanted to sleep. Taking 5, 6 of those, I had to get my gut to relax because my gut didn't want to do anything. It's like, what in the heck did you do to me? So that's how I did it. I got myself out of a mess, but patients have lost their colon. All right, this one's for you. Okay, Maria, I haven't forgot about you. Maria's in the Bahamas with her friends. She's walking along the dock, and they're laughing, having a good time. Guess what Maria decided to eat? The guy's cutting up some raw conch. Hey, Mom, you want some? She had a piece. Now, you know how sick you can get from eating raw? Ask Maria. She'll never forget that. You immediately have to catch this. All right, you ready? How confident are you in what you do? You know, doing different stuff, I've been beat on for 44 years and it never bothered me. I just went and beat everybody and became ridiculously successful with a technique that people made fun of until they realized, oh my gosh, maybe we shouldn't have been making fun of this. Maybe we should have been listening to this. Yeah, maybe you should have. This guy, there's Anthony. I'm swamped. He's in room 1. It's all about a heart transplant. COVID attacked his heart. It's all working out. I walked in. It's all the big deal. You ready? This is important. He's scheduled for heart. They're going to say we might have to replace his heart. Me and Lauren walked in the room. His heart reflex was shot. When I could shut the reflex off and it came back to life, I immediately, there's no way this guy needs his heart replaced. You guys have read this wrong. I went up against every institution and said, this guy's not his heart failing. You guys are failing. Watch what happened with heart failure in a heart transplant type person. How important is muscle testing really? Because Anthony was diagnosed with complete congestive heart failure. I'm going to ask him to give you a little short story about his journey. I'm going to tell you what happened in 5 minutes.
In December, actually, I was feeling sick. They diagnosed me with RSV. I had that for about 2 weeks, but nothing was changing. I was still having difficulty breathing and all that. Went back to the ER. They saw some fluid erect around my lungs and around my heart. I had 3 heart catheters done in the beginning of the year. I thought I literally had some type of heart blockage, and they were ready to put a stent into my heart, which they didn't find no blockage with that. They put me on a bunch of medications. I was taking about 10 medications. They diagnosed me for having congestive heart failure. Kind of irritated because I asked them, what's a 49-year-old person having congestive heart failure? How did they get that? The doctors couldn't explain that to me. One of the cardiologists asked me later if I had COVID, and I said, yes, I did. They said, well, we think it's possible a COVID-related injury. Got sick again. This time I got influenza A. I went back to the ER. They saw some fluid built around my heart again. Was admitted again back into the hospital. Stayed in the hospital for 9 days. They did another heart catheter. Thought I had some type of infection in the heart, so they did a biopsy. My ejection fraction of my heart was down to 15%. So they wanted to place me on a heart transplant list just to be on the safe side. After a week, came here. I talked to Dr. Tent, Dr. Gill. They put me on a bunch of supplements with that to help get my heart back. Went out to Grand Rapids actually, go through the heart transplant list. I wanted to see what my ejection fraction was, and they determined that it was about 30%, but they noticed there was some scarring on my left ventricle. Nurses were telling me that I wasn't a candidate for a heart transplant. The hospital called me and said, you're not going to be on the transplant list. You're too healthy. Been on the supplements. I had 10 medications. I'm now down to about 5. Went to go see the cardiologist, and he basically said to me that the symptoms that I had with patients getting the vaccine, the COVID vaccine, during the first round, I never got the COVID vaccine. It was kind of shocking to hear a cardiologist literally say that to me, that the symptoms they saw in me, they saw with individual patients with the first round of the COVID vaccine. Dr. Tent did a test on me today, said that my heart is fine, is doing well, and then just to keep the course.
It was a strange day. It was packed in here. Lauren came to me and said, look, Anthony's in room 1. They think he might need a heart transplant. You got to go in there and see. I was busy. Sometimes I work extremely well under pressure. I looked at Lauren, I said, all right, let's go see if he really needs a heart transplant or not. I walked in the room, he was very emotional. So the old Dr. Versendahl test, put your hands together, arms out straight, simple shortcut to the heart, a test I've used forever. It was so weak, he was so emotional, I did not trust him. So I stood up his wife, I said, we're gonna find out if this is real or not. His wife is strong, she's sturdy, she tested perfectly. I backed her up to Anthony, who was all distraught, and her arms, his heart was very, very weak. This is real testing. Now, if you're in real heart failure, I shut his heart reflex off, and I could stand on the arms. If his heart was failing, it would have stayed weak. All the rest of them were weak. It took 2 seconds, and this guy's heart's not failing. Watch what happens. We had him off the list in how long?
By the next week.
And what's your ejection fraction up to?
Now it's at 33%.
Muscle testing said there's no way this heart's you could shut it off. If his heart was really failing, the reflex is shot. You can't shut it off. An old-time muscle tester, which not many of us are left, I'm sharing this story with you guys so you can learn this. Everybody was shocked. It took about 4 weeks and he's done. They can't figure out how it happened. I'm going to show you the 4 pills I put him on to get him off that list too. Enjoy the story. "4 weeks, he's off the heart transplant list, back to life. I didn't beg, I didn't ask. It was simple. I could shut the reflex off. He had an active heart reflex. Simple muscle testing. There's no way this guy's heart's failing. I made the claim. It was easy to fix. Done. You'll hear it. Good story. Now, how about this? You know why I didn't want to go to the hospital? Simple. They all wanted me to go to the hospital. I was sick. I'm not going to the hospital. Why? Because of this. She was in yesterday. Look at that smile. Cecilia has a crummy heart history. It's crummy. She's had a heart attack. She has my blood work. It's terrible. I'm treating her. She's lovely. Her husband comes in, her kids, they're wonderful. She always has a smile. She's smiling. Look at her chest. Now, she's doing all my stuff. She wakes up with a piercing pain right here, screaming with her husband. I got to go to the emergency room. They take her to the emergency room. They said, the only way that's going to stop is if we take your heart out. A double bypass, 2 valves, 1 valve, double bypass, replace your valve, and she wakes up. The pain was exactly the same. She had a gallbladder attack. They took out her heart. She had a gallbladder attack. She's on beta food. She's getting better. She's got a scar. You want to know what it's like to be unhappy? Ask her and her husband what it's like now. They just popped her heart out and it had nothing to do with chest pain. This was last week. This is 2 weeks ago. That's why I don't want to go to the hospital. I can't imagine what they're going to do to me. I don't know what you're going to chop off. That was awful. Too much peanut butter, too much coffee. A simple gallbladder attack has cost many people their heart. Now, in my career, I've been an athlete. I was a sprinter. I was a hockey player. I was a baseball player. I coached the team in chiropractic school. I batted third. I played left field. Me and my friends were real athletes. I had a bad foot. When you men talk about your nodules and your spots and your bumps and the doctor's got you all worked up, there's a hole in my foot. Now, when I grew, look at the size of that hole. That's a bone cyst. I played sports on that. Every once in a while, I had to run on the end of my toes because when I grew, it grew. Now, I showed that to the medical community. What would you have done with that? We'd have drilled a hole in that to see what it was. My entire sports career would have ended the day they popped that balloon. It's still in my foot, and it still hurts. And I grew a spur under that to protect it. And that spur doesn't even hurt. My body protected itself. There's a hole in my foot. And if I'd have complained about it, they'd have wrecked my life. I kept this to myself because everything the pediatrician touched, he ruined. You're not wrecking my foot because I walk on this thing. I got a hole. So if you think your nodule's a thing, I got a hole in my foot. I talk about coughing at home for free. Watch people go to the hospital for a fever. I'm just speechless. This one low testosterone man, he had a rib out of place. Adjusted his rib. His wife calls, his rib still hurt. I said, I just put it in place. Give him a day. I'm scared. Go to the hospital. He went for observation, $8,000 to watch him one day because his rib was out of place. $8,000. I hope you like that. Hope it was worth it. People are commenting all over that people have different personalities after this vaccine. Road rage, this crosses the blood-brain barrier and starts destroying the brain. Road rage, fights, aggressive behavior, this is not the time, men, to have low T. It's not the time to be weak. And when you look at the guys you think are weak, it's the guys you think are tough. They dress this way, they act tough, but they're not. I can spot them a mile away. Do not think you can fool me, because you just can't. It's easy to spot. I can make them cry. It's sad what they've done to the men. You want a promotion? I want strength. You want the girl? You better be stronger. You want the house? I hope you can get it. You know, you want to win the fight. I've never had to fight because I was tough enough. Men don't mess with me because they can tell it's going to be kind of a trade-off. And I am not a violent person. I am not a fighter. I don't have to be a fighter if you're a normal guy. Who can put up with this? Real high testosterone men consider this an abomination. Do you know how many people say, oh, it's okay, it's his thing? This isn't right. You can't run a country in a military like this. We're the laughing stock. I told you it was a movie. This wasn't real. You're seeing the change now because the 4-year movie's over. Now they get to do what they wanted to do. Am I supporting it? It's what it is. It is what it is. Whether you like it or not, this was a clown show. No men should ever have to put up with this. Ever. It's embarrassing. They wanted me to have the staff wear that. I said, not a chance. It ain't going to happen. Period. I was tougher than them. The dating pictures. Boys, you're going to be single for a long time. If I could have showed you all the ones on Melissa's phone, I have a commentary. I wish we could do a monologue with these. I could give you each, here's this. I have the girls, I can make them laugh, describing what you guys look like. Do better if you want to date. It's embarrassing. FDA's warning, I talked about this before, psychedelics, peptides, stem cells, raw milk, hyperbaric therapy, chelating compounds, ivermectin, hydroxychloroquine, psychedelics. You know what PubMed says? I know, oh my gosh, everybody in this office, I made Craig and Jeff try this. You know why? Because I want you to Google PubMed. I want you to Google magic mushrooms and depression, magic mushrooms and anxiety. The level that corrects brain chemistry you could give to your grandma in Sunday school. There is no cognitive effect at the level that repairs brain chemistry. That's what the literature says. If you take too much, you have weird symptoms. The microdose is established in the psychiatric literature. It works better than every antidepressant that they used. It's in the literature. Look it up. It has nothing to do with hallucinations unless you know how to misuse it. It repairs brain chemistry better than anything for PTSD. And the psychiatrists are just waiting to get their paws on this. Look it up. It's right there in front of your face. All of our faces. Now look, I love brain chemistry stuff. Dr. Thiel knocked it out of the park. Complete brain health, organic mushrooms. No psilocin in that. That's the lion's mane. There's 5 of them in there. You want to give your brain a little healthy overhaul? 5 of each of those. 3. You will notice this on the second day. I love working with my brain chemistry because everything out there is to make us depressed, weak, and miserable. People are miserable. Work on your brain chem. Your family doesn't want to see you this miserable because people have miserable members of your family. Work on your brain chemistry. Try to be happy in the house because you can't live in this cloud over everybody's house all the time. Everybody's burned out. Work on your brain. These are huge hits for your brain. When I got nothing else to do, I'm overhauling something all the time. Department of Health. You've got to be kidding. We people stood around for this? Which one do you want running the health department? Butch or Kennedy? I'm not going to put up with this Halloween dude. If you want to dress up, stay in the closet. That's ridiculous. I'm embarrassed for him. Make men healthy again. For Pete's sakes, your wives want this. I have more women in my office complaining about their men sitting home watching Rachel Maddow and CNN, and they're going nuts. What happened to my husband? You men have no clue how many of your women complain about the things that you sit and do all day. They want a man. You guys have choked. I'm telling you, hit this. When 25-year-old kids say, that's the best thing I've ever done. 25? 30-year-old kids? They're in menopause. They're in male menopause in their 20s. You hit this hard. 8, 2, and 2. Try a month. Watch what happens. You might be shocked at how simple. Geez, I feel good. Men come in here, they're so weak. It's killed them. You want to eat like this? This is what the church people told you to eat like. This is what the old timers told you to eat like. This is if you follow the carbohydrate crazy people. That's if you follow the carnivores. Our entire life was backward. They lied to you. The doctor that gave you the shots told you to eat, so you ended up like that. When is enough enough? What would take it? That's why I can only work 3 days. Everybody's coming in, doing things that's making them sicker, but they're happy because somebody else paid for it. It's the dumbest thing I have ever seen, and it's weak men. God, you guys are weak. I watched a special on Greenland. Since we're going to steal Greenland, all right, I want to see what's going on. So me and my wife sat there, and I watched the healthiest looking people. It's 100 below. The wind's 40 miles an hour. They're standing out there looking like this. They glowed. They had skin. They were beautiful. Here we sit in the salons, and you're putting all this crap on, and go to the mall. That smells going through the mall. They look like crap. Our food has made us, you know what they eat? Raw seals. They take the seal, they cook the seal, that's all they eat. If you don't get a pizza, you get a seal. The saturated fat has made them beautiful. The environment is against them. They have better skin than you guys living indoors. Their diet has made them glow. You spend all your time at the salon, you got crummy skin because you got no saturated fat in your body. I pound the fat so I don't look like these old dead white guys. Amazing. Fat, that's what it looks like. Some of the best skin I've ever seen. Now, I was 6 days in Hawaii, okay? 6 days. No sunscreen, 6 F pearls, 6 Calma Plus, that's supposed to be up there. At night, I put the USF ointment on my face. No sunscreen. I don't want that. I never want that crap on my skin. I use my brain. It was awful windy. We had a little covering thing out in the sun, in the shade, out in the sun, in the shade. I was able to get a great tan in 6 days with nothing on my skin except nature. It's windy. Everybody's got different skin. Think. You wear that light shirt that the sun, that blocks the UV rays. I'm not putting junk on my skin. There's my son. I'll give you a little advice. Maybe some advice. If you have a successful business and things are going really well, before you retire, you should probably take a family vacation. It's going to help make that decision clearer. This is what it says getting into the water in Hawaii. And I sit and watch all the people abnormal skeletal growth, cancer, coral DNA damage, cancer, deformities in how things grow, cancer, increased coral bleaching. All it does, and it's telling you, this stuff causes life to get cancerous. They told you to put stuff on that gave you cancer, and everybody does it. This is cancer. You can't put on a coral because it causes the coral to grow funny. There's that benzone. All the people put benzene on their skin for acne. Benzene's a poison. This is all poison. I don't even know what to say. Well, I got a tan, 6 Comma Plus, 6F pearls, USF ointment. I'm not putting a carcinogen on. Clean yourself up. Men, I'm making it simple. This is all my vegetables, all my plastics, all my estrogen removal, all the lawn sprays, all the perfume. I gotta touch you people. I smell for hours after I've touched you people. Gosh, these men smell pretty. You smell pretty. But I don't want this on my skin. It's absorbed through my skin. This is why I eat very poorly. This is my vegetables. This is my greens. This is my detoxification. It's all the same pathway. My medicine is my food, and my food is my medicine. I could have a loose coney, I can have a cheeseburger, I can have a very simple diet around these things. Now, this is for the average man and woman. If you're very estrogen dominant, that's where this comes in. That's much stronger for estrogen dominant people. This is for the average one. This will take care of most of your poisons and your chemicals. That's all I do. Should I detox? Detoxification is part of my life. I'm not going to do this once a year. They're poisoning me daily. I detoxify all the time. And my pathways are wide open because of this. Those 3 run the show. Like I said, remember, I don't drink no American beer. It's feminizing the men. The hops is a very estrogenized grain. I'm giving you a bonus. You're tired, you didn't sleep, you got a long shift, you got 2, I did this morning. When I got to produce all day, 1 and 2. Now I want you to be healthy. I don't want you using this as a crutch if you're sick. I'll share this with people once they get their health back in line. I love extra energy when I need it. You don't push a broke down engine, but if you're healthy, I can have some nice all-day energy, irregardless of the status that my energy's in at the time. Now, this isn't a message to anybody. This lady has driven Indiana. Is it Indiana? These ladies have driven 20 years from Indiana. And she wanted me to sit down. She is a raw foodist. She's a real, live, raw. She said, look, you got to sit down. We don't talk about food. I don't care how people want to eat. I eat a certain way. I like it. It works for me. I'm pretty happy about it. So this lady came in to make a gigantic announcement to the office, and I said, could you film this, please? Hit it. It's possible. Miracles can happen. My hardcore vegetarian, my raw foodist decided to change. She's been a carnivore for 1 month. What's happened to your life?
Oh my gosh, I thought I was doing fine before. I am over the top, feeling wonderful. I'm a yoga instructor and I am more flexible than I was, and I just thought I need to give this up. I don't know what's going on, take it easy. And so I have energy, my emotions are on a more even keel, and I didn't even know that was an issue. This gentleman's preached to me. Dar finally got the message.
I'm surrounded with this all the time. I'm on a high-fat, high-protein, high-cholesterol diet. That's what we were supposed to do. We were designed for this. They told us not to do this. She learned the hard way. She feels great. Her skin never looked like this. She was drying out in front of me. This is 1 month. What a gigantic change. Pay attention to what's going on out there. Fat, cholesterol, and protein was not a sin. It's healthy. Enjoy a new life. How do you like that? Do you know how many people went this way? The amount of people that went the other way and had that story is so weak. This is 44 years. People act like I don't know it. It's a half a century almost. This is the commonest thing I hear when people clean up their diet intelligently. My God, it's a long battle. Thank you, Darlene. I appreciate that. She thought I was going to fall over dead. She sold herself. I never told her to do this. She did it on her own. Bread is sugar, rice is sugar, pasta is sugar, fruit is sugar, cereal is sugar. You're all living on sugar and you don't think you are. It's sugar. Everybody's fat, sick, and diabetic. It's sugar. It's sugar. No matter how you slice it, it's sugar. This is what the Bible says. Lamb, 200 times. Raw milk, 50 times. Cow, 270. Pomegranates, sourdough, goats, figs, fish, honey, butter, salt, olive oil. Eat biblically. That's what it says. And it says it that many times. People try to, oh, no, you can't eat like that. You got to eat weird till you're sick in a week. I just watched a bunch of vegetarian men talk everybody getting shots so Jesus would like them better. And it's awful embarrassing. High protein. You see, there's other things on this. It's not all meat. You can do protein. Don't be brain dead. Get your skin looking better. It's simple. High protein cheat sheet. It's all protein. Now this is hard because there's a lot of mercury in the tuna now. It's kind of you're between a rock and a hard spot, but learn protein. I love these two. I don't handle my carbs and sugar as I get older. 4 each of those a day, man, does that give me sugar control. Sleep, sugar. If you got pre-diabetic stuff, look into the Ignite. But those two, man, it just makes my blood sugar so much more stable, and my sleep follows my blood sugar. At this age, I can't sleep on the things I could sleep on at 20. My body's changed. Weight loss support, learn how to eat. The girls are having a blast. We talked about the Stellos, and my wife had a great experience with that. She learned about some of the food she was eating, caused some swings, and she made some adjustments with her diet. I was able to, piece of candy, piece of meat, candy. I was playing the candy protein thing, and I could keep my blood sugar. You're trying to keep it in the green. Everybody was shocked to see their weird food triggers. Things will bother one person that won't bother another person. You need to learn how to eat. It's pretty fun. I did this for a month. It was fun to watch this, and you're going to have to take yourself, the health in your own hand. Find doctors that are going to help you, because what just happened was they got rewarded to thin down the herd. They got rewarded to thin down the herd. Did I say that too fast? Should I take it slow? My God. Women, before you give yourself cancer with all your hormones, change your life. Spread that throughout the day. 8 a day, 2, 4, spread it between see what you can feel like to overhaul your hormones. Pituitary, thyroid, adrenal, ovaries. My pill, same thing. Testicle replaces the ovaries. Want to give yourself a midlife overhaul? Take 8 a day, spread it out. Watch how much perkier you can feel. Fatigue, moody, depressed, and no sex drive runs the females today. That helps all of that particular issue improve. If I wanted to give all you women one thing to make you look better, it would be chlorophyll pearls. Chlorophyll pearls makes you glow. The blood of plants. I'm very fussy about my greens. I eat dead food and look like this. This is my color. The nitro greens, simple stuff. Build up your blood. Kids, if your kid's around all those vaccinated kids that are sick all the time, 1 a day. It's simple. Everything they need is in that. There's your bacteria, there's your viruses. 1 a day, your kids will be well. Would you guys like to have a tetanus shot today? No. Would you like to have a COVID shot? No. I want you men to learn how to say no. I split my head open at Sears when I was 17. They made me go to the industrial clinic. The little foreign dude walks in with the plate. I'm bleeding from the top of my head on a file cabinet, just a little blood on my head. You need a tetanus shot. I said, no, I don't. Yes, you do. No, I don't. Yes, you do. I said, no, I don't. I'm not getting a tetanus shot. Just forget about it. He said, you might get lockjaw. I said, I'll risk it. I'll risk the lockjaw. Do you understand? These foreigners are so easy to deal with. You're tougher than them. Just say no. They're not even going to argue with you. They don't argue. They're happy. You get pushed into stuff that you don't have to get pushed into. I'm sitting at 17. I'm not doing this, Chief. I'll live with the tetanus. I'm fine. Give me a bandage. I'm back to work. I want you to support local people. There's doctors all over the world that are doing great stuff. You support the doctors. I'd appreciate it if you support DHS. You support us, we'll stay here, because I could run pretty easy. I don't want to do that because there's nothing to run to today, because the world ain't the way it used to be. Sitting around with a bunch of retired people right now makes me feel like I'm in a Lawrence Welk show, and that ain't going to happen. It's horrible. Now, I'm going to give you a little tip. I said something years ago. I said, how many people know who Admiral Mike Rogers was? And nobody knew who he was. Admiral Rogers prevented the coup in America. There's the slide. March 26, 2019, Rogers went to Trump Tower to tell him, look, the entire thing is bugged, top to absolute bottom. Obama was not happy that he went and did this. Trump moved his entire election operation to New Jersey the following day. The entire thing was bugged. And if it wasn't for Mike Rogers, the world would have looked different. So we owe a tremendous debt of gratitude to Admiral Rogers. That's where it came from. What we offer at the office, there's all kinds of things here, genetic testing, chiropractic care. You can read that for yourself. I appreciate you supporting the office. Thank you all for watching. I'd like to make America strong again, because if you men want to step up to the plate you could have been in life, I've done this from a position, thank God, I've conquered. The job, the girl, the retirement, the house. I'm watching people that can't get over that first hump because the fear has stood in their way of everything. I'm trying to make you stronger so you can accomplish your goals in life, because the society tried to take it away from you. Get tightened up. We'll see you next time. Thanks for watching.